Hi everyone, Dr. Rich Castellano here, the Smile Doctor. We're here with Janessa. Thank you for letting us share your video today. So we're going to be doing some Bellafill treatment. She's got a little bit of acne scarring. Janessa is definitely an A+ student looking for extra credit. She looks amazing. And we can soften a little bit of the acne scarring. How long have you had the acne scars for?
I would say since I was 18 and I'm 33.
Okay.
So
does not look 33.
Mm-hmm.
Looking good. And you did a little bit of the microneedling.
Yes.
She did a couple sessions. Normally you might need to do 3 or 6 sessions, so additional microneedling may help. And but she didn't see much results from the microneedling.
Right, and I kind of like gave up.
Got it. So the test we use for the acne scarring with Bellafill is if you pull on the skin, if you see it improve a little, the plumping the skin with the Bellafill may help. So we did that, we saw some improvement. We can't take them away, but we'll make them as good as we can. Any questions about our goals for today?
No.
Okay. Now, the other question is about, sometimes I can use little, what I'm going to do is I'm going to try and inject directly. If you feel it's too sensitive, I can just numb the whole area.
Okay.
But I'll try it first. There's numbing medicine inside the Bellafill, so you feel some pinches. But I like to do it that way because we want to thicken the skin, and I don't want to distort the skin too much with the lidocaine. So you're going to direct me, okay?
Okay.
All right, very good. So I'm going to do, and we got her pictures, and you can see when we take the pictures, if you take it with a little bit of a shadow, you can see it accentuates the acne scarring. Of course, when she's in good lighting and when she's smiling, you don't really see it that much, but it is important to our acne scarring patients who want to improve it as much as possible. So I'm going to do a cleanse on the skin, and Ari has everything set up perfectly for us.
Thank you.
So this is an intradermal injection, and you can do subcision, but I think subcision is really better for large acne scarring. This is a little, really not as deep. Let me have you rest your head all the way back. A little cleanse on the skin. We'll see her back in about 6 to 8 weeks, and then at that time, we'll look at the pictures and she'll decide, do I like it or do I want to add a little bit more? So this is the progressive approach. She asked the question, she says, are her cheeks going to look too wide? And the answer is no, that's not going to happen. Because she already has good cheek volume, we're just going to thicken the skin a little bit through that area. And so I'm going to scoot this over here. I'm going to start on this side. I'm going to turn your head a little bit. So we're going to start over here. Okay, so there's numbing medicine inside the Bellafill. So you'll feel a pinch, and if you need a break or you let me know if you need to do more numbing, I'm going to turn your head this way. So right here, I'm just going to start. This is intradermal injection. So you feel a pinch, 1, 2, 3, pinch. And then I'm just thickening the skin. Now, if you look closely, you can see just like a little bit of plumping. How was that? Small, medium, big? Not too bad?
Small.
Okay. Little pinch here. So we're just trying to thicken the skin and reinflate the skin. So I'm literally using, far less than 1/10 of a cc of the product. I think the acne scarring that she has, subcision would not be the right choice because, and now I'm also massaging, so I'm pushing up against the bone, so that way it spreads it out through the dermis. I'm just going to hold a little pressure there, pinch, 1, 2, 3, pinch. So as long as the patient's comfortable, that's what matters most. And just putting tiny, tiny bits in each one of these little areas. After we do a treatment, our vision gets better and our memory gets worse. That's why the pictures are so important. And the dermis has blood supply, so you do have to hold some pressure on those areas to get a little tiny bit of bleeding.
Carmen is asking, I'm 61 years old and a pre-diabetic. It's okay for me to do a treatment?
Yes, we can help you. We absolutely have patients that have diabetes and that are 60s, 70s, 80s, 90s. So we're massaging, holding pressure. When you're going through the dermis does have a vascularity. So you will have to hold some pressure, try and reduce bruising. But you'll create even more bruising if you do the subcision. So this is just injecting, and you can see there a nice little plump. Little pinch. And I'm injecting with the face, the aperture of the needle is faced down towards the skin so that it goes directly into the area. And so far I've used about 35-40% of the syringe. I'm going to use 50% of it here, the other 50% on the other side. Little shiver technique. If I feel pressure, that will allow me to just put a very small amount. And you may get some of the injection in the subcutaneous, and that's okay. Okay, so now in this area, we're going to shift sides. Now I'm going to have you just place your fingers right there for me. There you go. Just hold that firm just like that. We're going to work on the other side. I'm going to have you turn your head this way a little bit. Okay. So you see all these areas here, which they are very subtle. Little pinch. 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 And then as we say, you don't want to taste the chocolate cake before it's done baking, right? We need to let that settle a little bit. And for the physicians and students that are watching, if you see a little blanching like that, very normal, and that will go away. You can actually, and that shows we got it right into the dermis because it's blanching that part of the dermis. You're not going to create any necrosis of the skin with these little types of injections here. Pinch. Pinch. Now we do have laughing gas if someone is really sensitive to the injections, but most people don't want it. Everything's looking good. So this is one syringe. When we were talking earlier, I told her we could use even up to 2 or 3 syringes. We're starting with 1. We're going to see how that does. We can always come back and add more. So there's 2 effects that the Bellafill will have on the acne scarring. One is thickening the skin itself. The other is plumping from underneath. The plumping and increased volume tends to minimize the appearance of an acne scar. The goal is to improve. We can't make it perfect, of course. She's got a great smile. She knows the power of smile, and that always looks the best. So now I'm just looking for each little spot here. And you can see that area where it blanched. You see that blanching is pretty well done now. There's just a tiny bit left. I'm going to have you do the same thing if you just hold your fingers right there for me like that. Let's take a look on this side here. Very good. So that you hold pressure for just a few moments and then it settles very quickly. And then I'll use this last little bit. Because we use every little bitty drop. Turn it this way just a little pinch. So these are intradermal injections as opposed to subcutaneous injection. So now that I've done the injection, what I'm going to do is I'm going to do some vigorous massage. You can let this side down. So is that too firm when I'm pushing?
No.
So what I'm doing now is I'm spreading, I'm pushing up against the bone, rotating up, down, side to side, back and forth. It feels nice and smooth. You can even kind of like pinch the cheeks a little bit. It's almost like kneading the dough for bread. I really don't do much baking, but I'm kneading the dough. Okay. Now, even if I didn't inject anything, she's going to have a little swelling just for me placing the needle, because the needle causes some swelling. So that swelling is going to settle down. There's a little bit of the numbing medicine, and then there's the product itself. So why don't you take a look and see. All right. It doesn't look too wide or too thick. You can see how it's a little swollen. How does it look so far?
Good.
Yeah. So it looks good, but this is not the final product.
Okay.
The swelling goes down, the collagen's going to build. Your family and friends, they're not going to figure it out. But you had something done. So you're going to pass the grocery store test. So we'll see you at 6 to 8 weeks. There's no restrictions in your activities. And she can still, if she wants to do microneedling in the future, she can. But in 6 to 8 weeks, we'll check in and say, how did we do? And take things from there.
Okay.
Any questions I can answer?
No, I'm good. Thank you so much.
You're very welcome. I'm glad you like it. And so thank you for watching. So this is about acne scarring. We can't take it away 100%, but let's make it as good as we can. Her skin is darker, so laser resurfacing, she's at risk for hyperpigmentation. I wouldn't recommend that because she's a Fitzpatrick 4. So Bellafill, microneedling, there are PRP and other treatments as well. Thank you for watching. We're on a mission to stop bad plastic surgery. We'll see you in the next video. I'm Dr. Rich Castellano. Go Bucks!